Sharon, I wonder if we could start first by talking about the direct impacts on young people from actually contracting COVID-19. Could you give us an overview of what we know about that and what we still need to know?
Well, it's a really, we're in a really interesting place in terms of this pandemic. So I guess when the pandemic started, we really didn't know what the impact was going to be on older people versus younger adults versus children. Fortunately, and I do say fortunately, the direct impacts of COVID on children is relatively mild. And that's fantastic, really, because imagine what this world would look like if it had been the other way around. Now, that doesn't mean some kids don't get sick, but in general, hospitalisations for children has been low, and those really severe impacts, including death, have been exceedingly low. So in general, COVID is a pretty mild disease in kids. We don't know what's going to happen with, we've heard these words, long COVID. We don't know enough about that in children yet, and there's various reports with actually conflicting results, so I think we're waiting to find that out. But in general, COVID is a pretty mild illness for kids.
And do we know is long COVID the same in kids as it is in adults, or is that whole area still very much sort of under discussion and review, I suppose?
It really is. I mean, there's been various studies, and you'll appreciate it's not so easy because we have to try and work out what were kids like with viruses before COVID, what were they like with, because, there's kids have had adverse effects to viruses before COVID, right? So it's trying to unpick all that. How much is the mental health problems related to the virus itself versus where we are in the pandemic? So it's trying to unpick all of that. But what we can say is people are looking into that. The rates are relatively low, and most kids, it seems to resolve within a few weeks. In adults, I think we're seeing higher rates and worse kind of impacts on the rest of their system, cardiac system, kidney system, etc. So it's not that there's no long COVID. I think we've just got a fair bit to learn.
Thanks very much, Sharon. Ian Hickey, again, it's an extraordinarily broad subject, but could you give us your overview of the mental health impacts of the pandemic of young people in Australia?
Yes, I think by contrast with the physical health impacts, I think we know a lot about the developmental and mental health impacts. So COVID, as Sharon just pointed out, fortunately from a kid point of view, has been okay from a physical health point of view, but it hasn't been okay at all from a mental health point of view. So what we've seen at different developmental stages, primary school kids, early adolescents, late adolescents, and then young adults, are significant changes. Basically, the loss of social connection through that period on schools, on development of peer relationships, experiences out the home, and the fear of what would happen, don't remember throughout the whole thing, fear associated with the whole thing, initially manifested as anxiety. Now we've seen ongoing mental health impacts well beyond that, just as simply attributable to the lockdowns, and a really changed society that we live in. So we are dealing with the long impacts, if you like, the long COVID equivalents in mental health now, very much playing out through our health system. We saw a lot of increased presentations to emergency departments with self-harm during various periods. We've seen national surveys of anxiety and depression. And now we're struggling with kids who've really had a lack of experiences throughout the whole period to develop the peer relationships, social relationships, and engagement with the world that they would have normally developed as a consequence of being out and about.
Ian, I read one meta-study of the impact on mental health and depression and anxiety amongst young people globally, and it was suggesting that the rates could literally have doubled. Is that the sort of scale of it in Australia?
So Australia, because we had as much of the lockdown effect, but without the physical health effects, if you like, without the sort of losses and deaths that we saw elsewhere in the world, we still had very large increases. So I think if you look at the world literature and the Australian literature, we did see about a 25% increase in the rates of reporting of significant mental health problems. And we certainly saw pressure on our mental health systems. People coming forward for care, kids had great trouble engaging with school and peers and other activities, and we're seeing that persist. So it hasn't simply gone away either as we've returned kind of going back to our normal lives.
That's fascinating. We are talking about COVID-19 and the impact on under-19s on the round table today. Sharon Goldfeld, if I could come back to you, one of the Murdoch Centre's reports on the impact on children had a sentence which really caught my eye, that the COVID-19 pandemic is unlike any previous pandemics or natural disasters in terms of its scale and duration. Just what sort of a task does that lead to for medical professionals in trying to, I suppose, just get your head around the range of problems that you're dealing with as they're unfolding?
Yeah, I think the scale, and Ian sort of alluded to that already, is that is what is kind of really at the heart of this. I mean, at one point in time, there were 1.5 billion children around the world not in school. So, the scale of this is really enormous. And similarly, for example, in Victoria, there are about 40 weeks over the 2-year periods where children were doing remote learning. So it's the scale that is really unnerving everybody, and thinking about what are the sort of systems we need to be able to put in place to respond to that scale as the impacts emerge over time. And I think we're already seeing that we're not 100% sure what they're all going to be, because, there were the direct impacts on the children, the lack of social connection, etc., the kind of existential threat stuff. Then there were the impacts on the parents. So don't forget, children live in families, particularly young children. And parents were stressed, parents were losing jobs, and parents were in lockdown. And then there was all the kind of lack of access to services as well as schools, childcare, the usual kind of developmental kind of touch points that children have with services, children with chronic diseases that weren't able to see their physicians or their allied health professionals in the same way. So it's kind of like that, stone in the pond. There's kind of circles of all of these impacts, and we don't actually understand exactly what's going to happen over time, but it's the scale that will get us, and it's the scale that makes us think about what are the system responses we need to be able to think about both now and into the future, both from oh my goodness, what do we do now? But hey, what an opportunity to think about systems differently.
Absolutely. Thanks very much for your texts and contributions to the roundtable as well. We've had a great range already. One from Michelle, who says that her son told me he feels that COVID's left him with low motivation due to all the lockdowns. His son's struggling now with the VCE at the age of 17. Text from Carolyn saying that she recently started a play group and found that the small children under 3 years old who didn't have any siblings hadn't been exposed to being with other children. Just a really fascinating and concerning range of impacts. Perhaps no surprise there. Ian, Hickey, of course, as well as the pandemic, kids going through these developmental stages will encounter mental health challenges in less extraordinary conditions as well. How hard is it to discern the pandemic effect per se compared to other underlying and perhaps more expected factors?
Well, this has been a really interesting thing, Julian, because and I've been involved in this kind of social research for quite some time. We were in trouble before the pandemic. So I think in Australia, we take our social safety net, our social connectedness, our local communities, the idea we support each other rather for granted. But actually, there's been less participation by children and young people and families generally in community groups, in sporting groups, in church groups, in activities outside their nuclear family for quite some time. And there has been increasing mental health problems in children and young people over the last decade in particular. And so we were in trouble beforehand, probably due to this, social factors that were not okay. And along comes the pandemic on top of that and really emphasises the extent to which it's very easy for kids to be isolated, to be at home, to not be socialising normally and developing normally through all those things like childcare, preschool care, primary schools, etc. But not just schools, in their own local communities, in extended families. So I think it's highlighted two things. We had a problem beforehand that we weren't really attending to, and that has been exacerbated by, and I think as Sharon pointed out, we've really got to think through now, okay, this is not snap back to where we were. We've got to think differently. I think very much at the local community level, and then in terms of the systems, health systems, welfare systems, social systems that support families. I think a very important point Sharon made is the family units have been under tremendous pressure. There's been surveys of mums particularly who are home with kids and trying to balance work and kids and everything else through this period, really under a lot of pressure. And actually, how do we go forward with that? Like, we're going to have to seriously think COVID's highlighted the problem that wasn't getting fixed beforehand. Now we've got a double whammy. We've got to deal with both. What we're doing socially, plus the ongoing effects of COVID.
And already you've highlighted one aspect there with the mothers in particular, but I wanted to perhaps drill down a little bit more now into within children. Are there sort of key demographics of concern, Sharon Goldberg, that we can identify as particularly adversely affected by these pandemic factors?
Absolutely. And sort of just as Ian said, there were mental health issues on the rise in the last decade. The other thing that has been around for the last decades is really substantial inequities in Australia. So if you sort of look at any outcome that you like, we've sort of got these almost tram tracks between the richest and poorest areas of Australia in terms of those differences, and they haven't moved in the last decade really substantially. So what COVID has come along and done is shone a light not only on them, but again exacerbated them. And we've got a number of studies that we've been sort of following families pre-pandemic, and then we're able to follow them during the pandemic. And what was clear was the pandemic disproportionately impacted those children and families who are already doing it tough. And so we're seeing this widening of inequities, the widening of the differences between those families in the poorest and richest areas and the poorest and richest families of Australia. And you can imagine some of those things just thinking in your own mind when we went into remote learning, what it means if you're in a family that's got, 4 computers and 4 phones and no problem with Wi-Fi, and families who are sitting around helping, versus some families that had no access to those sorts of things and they're still trying to do the same sorts of things. So those differences are widening, and we're seeing the initial results of that widening. And what's really scary, I think, for people like myself and Ian, who are researchers in this area, is we don't know in the current system if we're going to be able to pull it back, because we haven't been able to close the gap, let alone what's happening now. And I think this is why it's a point in time where we need to say, hang on. Not only do we not want to just snap it back, like, great, we can have the inequalities we had before, but is this a point in time where we go as a country, maybe we need to think very differently about the inequities we have and really substantially think about both at the local level but also at the broader systems level, what are the sorts of things we could put in place that we hadn't thought of before that really have a really strong focus on addressing the inequities in this country, and that's that real social justice approach.
Well, that theme is coming through loud and clear on our roundtable today on COVID-19 and the under-19s from both Professor Ian Hickey of the Brain and Mind Centre at the University of Sydney and Professor Sharon Goldfeld, Director at the Centre for Community Child Health at the Royal Children's Hospital. We've heard that phrase, systemic responses, from each of you. Ian Hickey, were there some things that were done well in the immediate response to the pandemic, and what are the systemic factors that you really point to in terms of where we fell short and where now more needs to be done?
Well, I think initially when there was so much unknown that governments had to take a pretty dramatic approach. And I think what dominated the discussion then was really the physical health threat. And to some extent, a 100-year-old quarantine approach, just everyone be isolated and stay that way, with an assumption, which I think was obviously wrong, that it would be for a very short period of time. So we did what we had to do initially, which was fine. But I don't think a lot of thought was given, in fact, to the mental health and social impacts of that being prolonged, which many people have argued was more likely in the first place, and how family groups would function, how different groups would function, what would be essential infrastructure, how would we organise our social behaviour, particularly to support families in these situations and particularly to support the development of children in these situations. I think it did see emerging as we went along the importance of schools and keeping schools open and trying to maintain those factors was being discussed. But a lot of the other rhetoric was really about isolation. You'll just have to sort of sit it out. And as Sharon pointed out, that was really difficult for lots of families, those who didn't have telecommunications infrastructure, those who are in really difficult physical situations, but also culturally and socially, that doesn't really work. We do operate in families and social groups. And I think other countries and other places were smarter about arranging smaller social group type functions.
Can you tell us a bit about that? That's fascinating, yeah.
Yeah, so I don't know if you remember this, but every old person had to somehow exist in their home on their own. families would be all isolated, people weren't allowed to contact each other. Much later on, like into the second year of all this, people said, oh, well, maybe it'd be better if, small groups of people could be in contact with each other.
But and is that because, as you mentioned, that other countries were approaching that issue differently?
Well, I think other countries had a more laissez-faire approach,
Right.
Okay. But some within that had a smarter approach of saying, okay, there are critical others, there are critical family members, there are people who are sick, there are people who are old. But I'd emphasise in this discussion, kids needed contact with a lot of other people, not just one parent at home or two parents at home or whatever they had. Particularly, as Sharon pointed out, I think in your introduction, there are a lot of sibships where there is only one or two kids. Kids are in much smaller family units these days as well. And so I think there were not enough consideration was given to really could we do it differently other than the absolute quarantine type approach, which really came from the early 1900s, and just simply got imposed. So I think there was a difference. And while that was perfectly reasonable right up front in let's say the first 3 months or so when really little was known and vaccines weren't available, as we've gone on, now we've got sort of the opposite. No one can be bothered with any public health measures now. And I think that's partly because everyone came to realise the social impacts were so large. It's not possible to live effectively. And I'd say in this discussion, the normal development of children can't proceed under those kind of absolute circumstances.
Mm-hmm. Sharon Goldfeld, in terms of your sense of what the systemic responses are that are required, is your picture of that in the sort of, I know we're not post-pandemic, but in this phase of things, different from what you thought was required to deal with systemic issues before the pandemic? Has the solution or the image of it changed because of this intense experience?
Look, I think that has been the big eye-opener for us in some ways. I say to people, what's fascinating is what we're able to do as a society that really, had you asked me 5 years ago, I would have kind of laughed. So think of what we did. We developed a vaccine within 12 months. I mean, that's just extraordinary when you put enough science and money into something that you can develop a vaccine within 12 months. What else did we do? We pivoted, to use a pandemic word, we pivoted to telehealth. So this is, the ability to be able to see children, families, adults, by video, etc. That was supposed to be a 10-year plan. We did it in 2 weeks in this country. 2 weeks. And we haven't actually gone back. It's actually changed everything. Medicare's changed. Everything has changed. 2 weeks. And then the other thing we did was we gave money to people when they needed it. So that was the JobKeeper program. Again, if you'd said to us 5 years ago, hey, we're going to have a government that's just going to give people money just so they can keep their jobs, you would have laughed, right? So I think the whole kind of way we're talking about things has moved from not a can and cannot sort of agenda, but actually to a will and will not. We're making decisions now about what we will and will not do. And I think that's a fundamentally different place for us to think about, because what we've realised is we can actually do a whole lot of stuff we thought previously was impossible. And that, to me, kind of opens up a whole way of thinking about testing. I mean, I'm not saying that I don't think any of us would sit here and go, hey, we've got all the answers, just listen to us. But actually, can we be really innovative in the way we test things going forward and just say, wow, let's just see what's really possible. Maybe we should be giving parents money. Maybe schools are a whole different place. Maybe we need to think about the whole digital agenda differently. So that's what I think it's opened up for us. It said, hey, innovation, this is what we should be doing. Let's be really clever and innovative.
And I suppose the challenge there is the commitment to being clever and innovative as compelling when the emergency is not as urgent as it seemed in those early days.
Exactly.
Hickey, Sharon mentioned telehealth there. What did you learn about the potential but also the downsides of telehealth in terms of mental health for young people through the pandemic?
Well, I think the first thing we learned was that digital infrastructure is health infrastructure. Just imagine we didn't have the digital infrastructure we had for education and health. What a disaster that would have been. So the end result of that, despite all the critique of modern technology, is in fact we were able to pivot in 10 days. I mean, I think Greg Hunt's comment at the time, we did more in 10 days than we'd done in the previous 10 years because we had to. A crisis made people do stuff in education, in health, And that was fabulous. To the extent we were able to carry on and actually live that way, was dependent on that. So health's really been challenged by that. Now, hang on a second, we never really took that on. But also thinking more broadly then, we can do this all the time. It's more convenient. In fact, attendance of young people at mental health consultations went up because they used telehealth. They actually didn't have to get to a clinic out of hours, meet with someone. The doctor came to them, came to their home at a time that was convenient to them. So
and is it as effective when that happens?
Yes, it is as effective. And in fact, you connect with people, coming back to an inequality issue that Sharon raised, you connect with a whole lot of people who were not being connected with previously, that relied on getting to clinics where there were large out-of-pocket costs that were very inconvenient. A lot of the work I'm tied up with, Julian, is in rural and regional Australia. And in fact, the services for the first time got to people that they hadn't got to when those people previously had to drive and travel to get them, which just ruled a whole lot of people out. And because of some focusing on some really disadvantaged communities by some of our health organisations, our primary health networks, etc., there was a real effort to connect with those who were thought to be in the most trouble. So I think it's really interesting what Sharon said. We did things about homelessness. We did things about mental health services. We did things about income support, which everyone said were impossible. Australians won't wear them. Well, guess what? In a crisis, we did see some really innovative solutions. I think now it's a matter of choice. Do we want to keep doing those things? And I think we have to think differently. I'm associated with a thing called valuing and measuring the mental wealth of our communities, not the mental health, the mental wealth, monetarising that stuff, not just GDP. How healthy is a community? Because you can measure this stuff, the connectedness, the extent to which people volunteer, the extent to which people take care of other kids, not just their own kids, and actually value that. If you value that, you start to design systems differently, education, health, and you actually encourage stuff that's actually of real value. Australia was lucky, I think, that the social fabric did hold together in ways that it didn't in the United States and elsewhere, which allowed us to both contain the virus but also support each other to some degree. Now I think we've got to go, hey, you know what? That's a better way to live. It's a smarter way to live. And actually, we're a wealthier country if we live that way. We have to spend more on some things, but overall, we're wealthier.
Sharon Goldfeld, in terms of that tension between backsliding after the sense of imminent emergency leaves versus actually bolting in and adopting some of the innovative responses, what's your sense of how Australia's doing at the moment?
Well, I think there are pockets and there are, wonderful movements like the movement that Ian's developing around mental wealth, where we're sort of saying, what are the things that we could be doing differently? And similarly, we've talked about local areas, and there are communities around Australia. We call these kind of place-based innovation, some of which are government funded, some of which are local funded, where people are going, hang on, we've got an opportunity now to do things really differently. I think the ultimate challenge is we'll slide back very quickly unless we can put a brake on it and then accelerate quite quickly forward. So you can imagine almost like a roller coaster, we're kind of heading back down the hill. Can we brake it and then accelerate back over the hill again and really see some very different ways of doing business? That innovation is likely to happen at a local level, and there are real opportunities like repurposing our existing social health and welfare infrastructure to actually work together and really meet the needs of their local families. And there's a whole series, our centre is working with communities to try and look at how do we do that? How do we use data, the actual fundamental bit of infrastructure, to say what are we doing and how do we do it differently, and how do we take families, children, young people along with us? And, it's very interesting to me, if you look in the tech side, we're incredibly good at innovating. We're far less good, I guess is the word, at doing that sort of innovation in terms of human-centred innovation. But we could. And I think this is what the pandemic has taught us, to say, hey, this has been a major disruption. Let's use that disruption to go forward quite differently. And as Ian said, value some things that perhaps we haven't valued before, and also recognise the generation coming through, essentially the COVID generation, will either stand us in good stead into the years to come on the things that we know are important, like climate change, etc., or we will actually have the next generation doing worse than the previous generation, probably for the first time in history.
We've only got a couple of minutes left, but we've had lots of great texts. Thank you to everyone who's texted in. One very tangible question, to throw it to you, Ian Hickey, is what do we know about masks and kids and the impacts of that?
Well, I don't think we know enough. What we do know, however, is that facial expression and the expression of emotion does matter. So we've thrown in a new variable, where that's been to some degree hidden. Now, of course, it hasn't really been hidden in homes and in other social settings, but certainly the sort of emotional connection with people and people being somewhat, and particularly younger children, being somewhat anxious and concerned about faces they can't recognise or people not being able to communicate in the usual way, one would be concerned. But I think, we're into a different kind of phase now. Everyone wants to be back to normal, but as we get back to normal, I think as Sharon and I are emphasising, really do we do things differently? Do go out of our way to take care of kids, not just your own kids, but to connect with kids in the community. I think face masks will turn out to be a very minor issue within that whole concern.
Sharon Goldfeld, do you agree with that?
Yeah, it's so interesting, kind of the little political footballs that have been created through the pandemic, and I think masks is one of them. I mean, what we know is that children have, in my view and the view of many others, kind of disproportionately felt the burden of all of the public health measures, actually, for which most of them were of limited benefit to them, but to the greater society. And I think we kind of sucked it up, as Ian said, in the beginning of the pandemic, but now we really have to say, where is the kind of cost benefit in terms of, say, for example, kids wearing masks versus adults not wearing masks in nightclubs, but kids wearing them in schools? It's kind of a bit out of whack. And I think we still don't have the right data to really tell us about the true benefit of masks on kids, or actually we don't actually know much about the harms either. We're kind of hypothesising. But yes. I do think we kind of need to reverse things and go, hey, adults, you wear the masks, you keep yourself safe where you need to, and let's just let the kids kind of do what they need to do, because we do worry that ongoingly there is this kind of, it's already socially a bit disconnected, could get worse.
Well, they are really mind-boggling problems with a long way to go, but it's great to hear that enthusiastic, engaged experts like yourselves are on the case. Professor Ian Hickey, thank you so much for being part of the roundtable today.
Thank you, Julian.